is
Good
called
morning.
bandha. What is bandha? Okay, bandha answer is already here, but try to give the bandha. Bandha actually means so something called which is connected, right? So now this is called a lock system. We have lock system to the houses, no? So the lock itself to the door or the separate lock which we put on the when we put what do you say kondiyanna hakdaga. So there we put the lock. So this is a lock system. You know just I'll just read the sentence. The little combinations locks when it gets traveled and it keeps the contents to your luggage as I explained, right? So which keeps safe your luggage, your house, or anything wherever you keep locked. So your body also has a similar lock system. Have you ever thought of it or have you ever come to know about this? If yes, it is good. If not, so this may be the first time that you may be knowing it. So these bandhas are literally means the lock system, which which tightens, which locks, which doesn't allow anything to come inside. So there are four lock system in our body. The major lock system are three, but combination of these three will be the fourth one. So there are totally four lock system. What is that lock? What are those locks? Mooladhara bandha, Jalandhara bandha, उड़ियान बंधा एंड महाबंधा. ठीक है. Once again, all of you please make a note of it. मूलबंधा, जालंधर बंधा, उड़ियान बंधा, and all these three together is called महाबंधा. ठीक है. So मूलबंधा, the perineum region you contract, you tighten that part. So that is moola. Moola is the base. What is the base of our body? The perineum region. ठीक है. Now jalandhar bandha, that is throat lock. There is something called kind of a jalgi, the net. So that is the reason it is said jalandhar bandha, because this part of your body purifies whatever goes into your body. So what will purify? The thing which is like a net. Like ನಾವು ಹಿಟ್ಟನ್ನ ಚಾನಿಸ್ತೀವಿ ಏನ್ ಮಾಡುತ್ತೆ ಒಳ್ಳೇದಿರೋದನ್ನ ಒಳ್ಳೆ ಹಿಟ್ಟನ್ನ ಹೊರಗಡೆ ಬರುತ್ತೆ. ದ ಫೈಬರ್ ಆರ್ ವಾಟ್ ಎವರ್ ಅನ್ವಾಂಟೆಡ್ ಥಿಂಗ್ಸ್ ಆರ್ ದಟ್ ವಿಲ್ ಬಿ ಔಟ್ಸೈಡ್, ರೈಟ್? ದಟ್ ವಿಲ್ ಬಿ ಇನ್ ದ net. So similarly will happen with our body also. If anything goes inside our body, most of the things or most of the bacteria are killed here itself in the nostrils. Whatever the things which are not killed, that will be the other practice will be done at the throat region. ठीक है. Now उडियाना बंधा. उडियाना means the abdomen. In Sanskrit, उडियाना means abdomen. ठीक है. Abdominal contraction. You contract the abdominal region. Mahabandha. Mahabandha is a great luck. The word itself is a Maha. My name is also Mahananda. So Mahananda, Ananda is a happiness. Maha is a great happiness. Nowadays, I am feeling very happy about my name because it is a great happiness. People do the yoga to be happy, which is ultimate. So my name itself is happiness, great happiness. Okay. So it was just an explanation. Mahabandha is a great lock. Okay. So here you lock all the three together. You lock the Jalandhar Bandha, you lock the Udiyana Bandha, you lock the Muladhara Bandha. All together you will be locking. So that is called Mahabandha. How it is to be done, we will be just practicing. So we will just come to Mula Bandha. Mula Bandha, cervix contraction or a perineum region contraction. Mula Bandha can be applied with internal or external breath. Please remember, here is also a breath retention. Breath retention, Puraka, Rechaka, and Kumbhaka. We have three concepts. Puraka, Rechaka, and Kumbhaka. Puraka is an inhalation. Rechika is exhalation. Kumbhaka is a retention. Now, when I say retention, what type of retention? There is no explanation that which retention it is, whether the breath is inside or outside. When I say just retention, you may not understand because retention are again two types. One is internal retention, other one is external retention. So this is called Bahya Kumbhaka and Antar Kumbhaka. ठीक है बाह्य कुंभक and antar kumbhaka antar the word name itself says internal antar means internal bahya that is external got it is this clear puraka rechaka kumbhaka in kumbhaka antar kumbhaka and bahya kumbhaka here this mooladhara bandha you can do internal or external any kumbhaka you can hold your breath inside or you can hold it outside. Okay. Now,
Ma'am, I have a doubt.
yeah,
ಇದು ಕುಂಭಕ ಬಗ್ಗೆ ಯು ಕ್ಯಾನ್ ಹೋಲ್ಡ್ ಯೋರ್ ಬ್ರೆತ್ ಇನ್ಸೈಡ್ ಅಂದ್ರೆ ವಿ ಇನ್ಹೇಲ್ ಅಂಡ್ ದೆನ್ ಹೋಲ್ಡ್
exactly.
ಅಂಡ್ ಎಕ್ಸೇಲ್ ಅಂಡ್ ದೆನ್ ಹೋಲ್ಡ್. ಓಕೆ ಓಕೆ got it.
Exactly. So in Ashtanga Namaskara, which Kumbhaka we have?
We inhale and then exhale. I
No,
think
we
exhale
inhale
and
and
hold.
then exhale. Yes. Then hold, right?
ಬಾಹ್ಯ ಕುಂಭಕ.
Bahya Kumbhaka, external breath. So they're specially external Kumbhaka only, no internal Kumbhaka. ठीक है external kumbhaka that is bahya kumbhaka so now mooladhara bandha breathe retention will be there now let us practice all together all of you please sit comfortably if you make yourself visible then I can correct yourself you because the posture and everything has to be correct when you do I need to understand whether you are doing it right or wrong so that was the intention kindly quickly turn on your camera let us not waste time because it is on the recording. Yes, little back, ma'am. Nikhila, ma'am, little back. So when you sit completely, you need to be visible to me. The sitting position. Sit comfortably. You can sit any of the meditative posture. Preferably Padmasana or Sukhasana. Now, how it is to be done? This is explained with the example. So, how it is to be done? You need to hold a perineum region tight. Now, we may not understand how it is to be tight. So, that may be the confusion in our mind. So, what is the example I gave? Most of the time, especially when we travel or when we are in the function of anybody's and you don't find any washrooms and all, so you feel that you feel that you have to urinate it. But what we do till we reach to that destination or any toilet, what we do, we will hold it. How do we hold it? Have you ever observed? How do we hold it? We hold it by tightening the the perineum region. We don't release the urination. We just hold it. So similarly, it has to be done. Okay. So sit comfortably and keep your spine erect. Have both the hands on your huh, have both the hands on your knees. Take deep breath in and out. Breathe in and out. Now take one long breath in and exhale all the way out. All the way out. Completely. Now feel that you have to urinate, but you cannot. So at that point of time, we need to tighten that muscle. So you just try to hold the urination. So start tightening the perineum region. Tight. Hold it tight. Don't release. Hold. as long as you can. Don't breathe in. Now slowly release the perineum region. Slowly release the pelvic floor. Slowly, slowly. Now breathe in. Take deep breath in and out. Breathe in and out. Once again, exhale all the way out. Breathe in and out completely. Make sure that you are not breathing in. Just hold your breath out and start tightening. Pull your pelvic floor upside. Pull it up, and hold it for a few seconds. 1, 2, 3, 4, and 5. Slowly release the pelvic floor first. Slowly release. Then breathe in. You should not immediately breathe in. Remember what I am explaining. Once again, 2 more practices we will be doing. Breathe in and exhale all the way out. Completely. Exhale. Exhale. And start tightening your pelvic floor. Pull little upside. Pull it up. And hold. Hold as long as you can. Hold. 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 Slowly release and relax. Slowly release. After releasing, then breathe in. Breathe in. Relax yourself. Last one more round. Exhale all the way out. Exhale all the way out. Hold your breath outside and pull your pelvic floor upward. Pull your pelvic muscles, tighten and hold it. Don't tighten it much, just squeeze it and hold it. Now slowly release the pelvic floor and breathe in. Relax. Slowly relax and come to the outer world. Very good. So, as there are some important points that you should not disturb your upper part of your body, that tightening your upper part body or anything or changing the expressions. So, that is not done by you. So, you are steady and in calm position. So, that is already done. Now you need to remember one important thing, that when you contract your pelvic floor, you should not overuse or over contract. So gentle squeeze has to be there, that you need to remember, right? Mhm. The next point is the Uddiyana Bandha. ठीक है? Uddiyana Bandha. How it is to, don't turn off the camera because we will practice all the things. So this can be practiced in either sitting or a standing position. ठीक है? Uddiyana Bandha, it can be done by sitting or standing position. While standing, place your hands firmly on the thighs, keep the legs apart and bend your trunk slightly forward and start practicing this. Now how it is to be done? What are the techniques? The techniques are, let us practice by sitting only. Especially boys can stand in practice. It looks like that you are doing some Nauli Kriya. Okay, Nauli Kriya by just bending down and the churn on the stomach region. No? So similarly it looks like. But it is not churning. We are just locking the system. That is Uddiyana Bandha is locking here. Now sit comfortably again in Sukhasana. Hands on your knees, palms opened or ceiling, or you can have any mudra in your hand. Let the eyes be closed gently. Take deep breath in and out. Breathe in and out. Now take one deep breath in. Now exhale all the way out. Empty the lungs and the belly. Breathe out till there is no any air left inside the belly. When the lungs and belly are completely empty, suck your navel region. Suck your navel region and pull little up. Suck your navel region and pull little up and hold it for few seconds. Hold. Very good. Slowly release the stomach region first, then breathe in. Good. Two more rounds. Exhale all the way out. Empty the lungs and empty the stomach region completely. Exhale. Deep exhale. And start pulling your navel region towards the spinal cord and pull little upside. First you suck inside, then pull upside. Yes, hold it for few seconds. Yes, very good. Hold it. Hold it. Hold it. Hold as long as you can. Otherwise, just wait for my instruction. Slowly release the stomach region. Slowly release the stomach region and breathe in. Very good. Relax your breath. Last one more round we will be practicing. Take deep breathe in. Deeply breathe in and out. Breathe in and out. Now start pulling your stomach region, that is navel region, towards the spinal cord and pull little upside, inside and backside and little upside. And hold it for few seconds. Hold it. One, two, three, four, five. Slowly release the stomach region first, then breathe in and relax. So sometimes we may not understand how it is to be done. You can come outer world slowly by opening your eyes. How many of you have had the noodles? How many of you have the noodles? You had at any point of time? You had. Okay. What about Sindhu ma'am? You?
Yes, ma'am.
You also. Nikhila ma'am? You also? Okay. One or the other way we might have had. Okay. So what we do, we the noodle we just put inside the mouth and we suck, no? Right? In the advertisement also it is shown by sucking the sucking the noodles, taking inside. Right? Similarly, when you do this, no, it has if you don't understand, just feel that you are sucking the noodles. Then automatically Jalandhar Bandha will happen. Okay? So this is the simple trick which I gave you. So by doing this, the diaphragm rises naturally into the thoracic cavity and the abdomen rests again back to the body, high in the thoracic cavity. So now hold your breath. That is already, it is explained, right? You can hold it for 12 seconds or 15 seconds or 20 seconds or 5 seconds. You can practice starting in the beginning. You start from 3 rounds. So today I made you to practice 3 rounds. Then slowly you can increase the numbers. 4 rounds, 8 rounds, 12 rounds, or you can do 5 rounds, 3 rounds, 5 rounds, 11 rounds, 21 rounds. The numbers are very important. Why do we give this odd number? That is very important. Okay. Now, how it is to be done? Contraindication. What are the contraindication? This must be done on an empty stomach. Not only this, all the practices, all the bandhas has to be done. So consider it for everything. So bandhas has to be practiced on empty stomach. Remember that during the retention of this lock, you are not breathing in and out. You are holding your breath. Yes, you have already done it. So you understood that. You are doing Bahya Kumbhaka, that is external retention. Holding the breath of out of the body is called Bahya Kumbhaka. So do not attempt to hold your breath in this position longer than can you do comfortably. So Ultimately, what they are trying, you, you need to practice according to your capacity. So you can do so comfortably without inhaling. So that you need to remember. It is common to cough a bit when learning. Sometimes. I don't know how many of you have had that. If you have not had, then it is good. Good sign. You had, Manoj sir? Cough you had while doing this? No, I did not observe anybody doing this. So
No.
note this bandha
But
can
I could
only.
not hold for longer than 3 to 4 seconds, ma'am. I couldn't hold for 5 seconds as of now.
So your the capacity of your respiration needs to be increased, ma'am. So keep on
Yeah.
practicing, huh? Keep on practicing. You will only observe. So today you found that you cannot hold it for 3 to 4 seconds, more than 3 to 4 seconds. So every day practice it. It will literally ultimately help you. I will help. I'll tell you where all it will help. Okay. Then
Okay.
when you come to know about the benefits, it will be strange. So it is not possible to perform this bandha after inhaling internal retention. This is little difficult. At least Jalandhar Bandha, to some extent we can practice by inhalation, but Udiyana Bandha is not possible. Let us do it practically. So sit once again comfortably. Only one round we will do. So it's for the better understanding. Sit comfortably. Take deep breathing and out. One deep breathing in and out. One more breathe. Breathe deeply, completely. Fill your lungs, fill your stomach region. Okay? Sit comfortably. Start inhaling. Start inhaling. Manu sir. Inhale ಮಾಡಿ. Day breathe in ಮಾಡಿ. In. Don't breathe out. Don't breathe out. Let the breath be inside and start pulling your navel region towards the spinal cord and let me know the experience. Start pulling your navel region towards the spinal cord and pull little upward and try to hold it. Okay, Sindhu ma'am can't do it. Okay.
Yeah, no.
Huh. So that
Try
was the thing.
ಮಾಡಿದ್ರೆ ಅದ್ ಸ್ವಲ್ಪ ಆ, ಏನ್ ಇಕ್ಕಟ್ ತರ ಅನ್ಸುತ್ತೆ.
ಹೌದು ಇಕ್ಕಟ್ಟಿನ ತರ
ಹಾ.
ಆಗುತ್ತೆ ಕರೆಕ್ಟ್ 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 ಸೊ slowly come to the outer world Manu sir come to the normal position could you do it ಮಾಡಕ್ಕಾಯ್ತಾ ಮನುಷ್ಯರಿಗೆ
ಎಸ್ ಮ್ಯಾಮ್.
ಯು
ಮ್ಯಾಮ್
ಕುಡ್
ಇದು
ಡೂ ಇಟ್
ನಾವು ಆಸನಾಸ್ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡುವಾಗ ಮಾಡ್ತಿದ್ದೀವಿ ಮ್ಯಾಮ್.
ಹಾ
ಡೀಪ್
ನಾನು
ಡೀಪ್
ಇನ್ನೂ ಒಂದು
ಸ್ಟ್ರೆಚಿಂಗ್
ಒನ್ ಮೋರ್
ಮಾಡುವಾಗ.
ಥಿಂಗ್ ಐ ವಾಂಟ್ ಟು ಟೆಲ್ ಯು ಹಿಯರ್ ಸೊ ಒನ್ ಈಸ್ some people can do it. This is also allowed. Inhalation or exhalation both are allowed, but little difficult. We are saying what we are saying. It is little difficult. Or it is if you say if it is not possible, it is not wrong because most of the majority when we say the majority, it is not possible. So for better understanding, suppose you what you do, take a balloon. ठीक है take a balloon you blow the balloon and blow is balloon is filled with the air now you tighten the front part that is the facial part of the balloon and you tighten it and hold it now start trying to push the balloon or the contract the balloon what will happen if there is some space to some extent it will contract if you do beyond this it will say bhad right it will be blast so similarly will happen with our body so these are the contraindication as a yoga teacher we should know it Manojji can do it because he is very slim and fit, so he may do it. But if you completely breathe in, sir, if you breathe, you fill your stomach region, and your especially the lungs. When you just fill the lungs, no, so you feel that your stomach is also filled with the air. But scientifically, when we say see that is there any space to for the air inside the stomach where we are taking it is not going to the stomach it will go to the lungs so Nikila ma'am may understand better so especially space is not there inside but when we breathe in we feel that there is a air is going inside because it bulges like a balloon okay ठीक है now coming to the Jalandhar Bandha is there any doubt in Udiyana Bandha or whatever I explained till now no ठीक है Jalandhar Bandha this is called throat lock you will be locking the throat system so here there is a change Here you need to breathe in. This is breathe retention. Getting my point? Breathe retention. Now what are the techniques? Again, all of you please sit comfortably. Oh, you can make a note. If you are making a note, make a note. Now once again, spine has to be erect. Try to keep your spine erect all the time. Expand your chest region, Manoj sir. Straight, sit tight. Good. Feel supported in Sukhasana. Let the eyes be closed. 2 rounds. Take deep breathe in and out. Prepare your body mind for this practice. Now inhale to fill the lungs about 2/3, not completely. You need to have some space inside. Now retain the breathe. Drop the chin down. Drop, yes, very good. Drop the chin down to the chest while lifting the sternum towards the chin and come in center. And exhale out. Exhale. Suppose if you swallow your saliva, this helps to feel into the bandha. Okay, we will do it with this now. Now once again, exhale 2/3 of the air. Inhale. 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 So don't completely inhale. Let there be some space inside. Now drop the chin down. Try to touch your chin to the chest or this bandha here in this part of the body. Now hold it for a few seconds. Now try to swallow the saliva. Just swallow the saliva and feel. When you swallow the saliva, you feel that there is some tightness where the saliva is not able to go inside. So that is called bandha. That is the lock. Now slowly lift your head up and release. Breathe out. Last one more round we will be practicing. Inhale. Inhale. Drop your chin down. Have the Jalandhar Bandha. Drop your chin down and hold it for a few seconds. Don't breathe in and out. Now slowly lift your neck up and relax. Breathe out. Breathe out. Release. Have you swallowed the saliva? How did you feel? Tight ಅನ್ಸಿತಾ ಇಲ್ವಾ?
ಹಾ ಟೈಟ್ ಅನ್ಸುತ್ತೆ ಮ್ಯಾಮ್.
That is called bandha, where you have locked this part of your body, in the sense the filter. This is the filter of your body, right? Okay.
ಉಜ್ಜಯಿ ಪ್ರಾಣಾಯಾಮ ಮಾಡುವಾಗ ಇದು ಸೇಮ್ ಪೊಸಿಷನ್ ಬರುತ್ತೆ. ಅದು
Yes,
ಸ್ವಲ್ಪ
yes.
ಅಭ್ಯಾಸ ಇದೆ.
Yes. Correct. You're right. So there was a Samudra Manthana which was happening, right? How many of you know? Everyone knows. One or the other way we know it. ಸೊ ಸಮುದ್ರ ಮಂಥನ ಆಗುವಾಗ ಮೊದಲನೇದಾಗಿ ಬಂದಿದ್ದೇನು? ವಿಷ. ಕರೆಕ್ಟ್? ವಿಷ ಬಂದಿತ್ತು ಸಮುದ್ರ ಮಂಥನದಿಂದ. ಸೊ ಈಗ ಆ ವಿಷದ ಪರಿಸ್ಥಿತಿ ಅಥವಾ ಆ ವಿಷ ಹೇಗಿತ್ತು ಅಂದ್ರೆ, ಸಪೋಸ್ ಅದು ಭೂಮಿ ಮೇಲೆ ಅಥವಾ ಸಮುದ್ರದಲ್ಲಿ ಎಲ್ಲಾದ್ರೂ ಬಿತ್ತು ಅಂದ್ರೆ ಇಡೀ ಈ ಬ್ರಹ್ಮಾಂಡ ಅಂದ್ರೆ ಈ ಪ್ಲಾನೆಟ್ ಸರ್ವನಾಶ ಆಗೋಗ್ತಿತ್ತು. ಹೌದೋ ಇಲ್ಲೋ? ಸೊ ಅಂಥದ್ದಿತ್ತು. ಅಂತ ಸಂದರ್ಭದಲ್ಲಿ ಇದನ್ನ ಏನ್ ಮಾಡ್ಬೇಕು, ಅಥವಾ ಇದನ್ನ ಹ್ಯಾಂಡಲ್ ಯಾರು ಮಾಡ್ಬೇಕು ಅಂತ ನೋಡಿದಾಗ ಯಾರು ಬಂದಿದ್ರು? ಶಿವ ಬಂದು ಅದನ್ನ ನನಗ್ ಕೊಡಿ, ಕೆಟ್ಟದಿರೋದನ್ನ ನನಗ್ ಕೊಡಿ, ಒಳ್ಳೇದನ್ನ ನೀವಿಟ್ಕೊಳ್ಳಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ವಿಷವನ್ನ ಕುಡಿತಾನೆ. ಹೌದೋ ಇಲ್ಲೋ? ಕರೆಕ್ಟಾ? ವಿಷ ಕುಡಿದಾಗ ವಿಷದ ಸ್ಟೇಟಸ್ ಹೇಗಿರುತ್ತೆ ಅಂದ್ರೆ, ಸಪೋಸ್ ಅದು ಬಾಡಿಯಲ್ಲಿ ಹೋಗಿದ್ರೆ ಬಾಡಿ ಪೂರಾ ನಾಶ ಆಗ್ತಿತ್ತು. ಸೊ ವಿ ವುಡ್ ನಾಟ್ ಹ್ಯಾವ್ ದ ಶಿವ. ಸೊ ಹಾಗಾಗಿ ಅರ್ಧಾಂಗಿನಿ ಅಥವಾ ಧರ್ಮಪತ್ನಿ ಅದಕ್ಕ ಅಂತಾರೆ. ಧರ್ಮಪತ್ನಿ ಬಂದು ಶಿ ಜಸ್ಟ್ ಲಾಕ್ಡ್ ದಿಸ್ ಪಾರ್ಟ್. ಹ್ಯಾವ್ ಯು ಕಮ್ ಅಕ್ರಾಸ್ ದಿಸ್? ಶಿ ಲಾಕ್ಡ್ ದಿಸ್ ಪಾರ್ಟ್. ಈ ರೀತಿ ಟೈಟ್ ಮಾಡಿಬಿಟ್ರೆ, ಟೈಟ್ ಮಾಡಿದಾಗ ಇಟ್ 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 ಡಿಡ್ ನಾಟ್ ಗೋ ಡೌನ್ ಸೈಡ್, ಇದು ಇಲ್ಲೇ ಉಳಿಯಿತು. ಅದಕ್ಕೆ ಅಂತಾರೆ, ಏನಂತಾರೆ, ನೀಲಕಂಠ, ವಿಷಕಂಠ. ಸೊ ದಿಸ್ ಇಸ್ ದ ಫಿಲ್ಟರ್ ಆಫ್ ಯುವರ್ ಬಾಡಿ. ಸೊ ಎಂಟೈರ್ whatever the unwanted things goes inside your body, this will be locked here. This is the filter of your body. ಸೊ ಇದು ಒಂದು ಚಿಕ್ಕ ಕಥೆ ಇದ್ರ ಬಗ್ಗೆ, ಜಾಲಂಧರ ಬಂಧದ ಬಗ್ಗೆ, ಇದು ಥ್ರೋಟ್ ಬಗ್ಗೆ. ಓಕೆ, ಮಹಾಬಂಧ. ಕಾಂಟ್ರಾಂಡಿಕೇಶನ್ ಅಂತ ತಗೊಂಡಾಗ, ಕಾಂಟ್ರಾಂಡಿಕೇಶನ್, the people who are not able to hold their breath or who are not able to lock, they cannot perform. Especially the cardiovascular disorder people, they cannot do this bandha, or any other person who are having discomfort while doing this. This was the simple contraindication where you could understand entire thing. Now Mahabandha, the great bandha, 3 locks. So 3 locks, see how it is done. So pelvic floor is locked here. Now here, this, see, navel has pulled inside. So this Uddiyana bandha is also locked. Now Jalandhar bandha. So how it is done. So similarly we will be doing now. Now when you do it without knowing this picture also, you would have done this similar things, because that happens. Now techniques, all of you please sit comfortably once again. Sit comfortably. Take deep breath in and exhale all the way out. All the way out. This is very powerful breath. This is very powerful lock. So take deep breath in, exhale all the way out. Now start tightening your pelvic floor first. See what I said? Start tightening your pelvic floor first. Then lock your Uddiyana Bandha, the navel region. Pull inside, little upside, and lock the Jalandhar Bandha. Throw your chin down and hold it for a few seconds. Hold it as long as you can. Hold it. Hold it. Hold it. Now slowly lift your neck up. Slowly lift your neck up. Release your Jalandhar Bandha. Release your Uddiyana Bandha. Then at the end, the Moola Bandha. Once again, exhale all the way out completely. Exhale all the way out. Start tightening your pelvic floor. Pull your stomach region inside, little up, the navel region, and lock the chin. Put your chin down and hold this for few seconds. Hold it for few seconds, or you can hold it according to your capacity. If you can't hold longer, you can, in between, you can release. Slowly lift your neck up, release the Jalandhar Bandha, then Uddiyana Bandha, relax your stomach region, then the pelvic floor, relax your pelvic floor, and breathe in. Last one more round. Exhale all the way out completely. Exhale. Exhale all the way out. Pull your pelvic floor up, in the sense pelvic muscles. Tighten your pelvic muscles completely, not hardly. Just squeeze your pelvic floor and the stomach region. Pull your stomach region inside, in the sense the region towards the spinal cord. Lift it up. Then put your neck down. Jalandhar Bandha. Put your neck down and hold it for a few seconds. Hold it. Slowly lift your neck up. Release the Jalandhar Bandha. Then release the Uddiyana Bandha and the Moola Bandha. And relax. Breathe in and relax. Breathe in and relax. Yes. Now here, actually this is a great bandha. The name itself is a great, in the sense great. It is ultimate. Okay, how ultimate? The Hatha yogis feel that if you are not practicing any asana with bandha or the breathe retention, it is incomplete, they believe. What they believe? They believe it is incomplete. It is of no use, they say. Why? One reason I will let you know. Why the Hatha Yogis do the difficult asanas? Hmm? Any idea why the Hatha Yogis do very difficult asanas? And if you go through the Hatha Yoga Pratipika, only 15 asanas are there. No many asanas. Only 15 asanas. Those 15 asanas does do the miracle. Those 15 asanas will help them to take to the samadhi, to the higher level. That is self-realization. How? How? Scientific reason I will let you know. See, Raja Yoga. No, not Raja Yoga. You will get confused. Maharshi Patanjali's yoga, Yoga Darshana. So this Yoga Darshana has 8 limbs, right? In the 8 limbs, there is one more limb is called Pratyahara. Pratyahara is having a control, instead of control, I should say, withdrawal of your sense organ from that particular object. Object can be, what are the sense organs? 5 sense organs. Yes. What are the 5 sense organs? Quickly, Nikhila ma'am. 5 sense organs? Yes.
Karna, Chakshu, Nasa, mm, throat, and then skin, twak.
Okay. So your skin, your eyes, your hearing capacity, your taste. One more is there. What is that? Kivi, kanno, hamugu. Nasika. Correct. Smell. So these are the sense organs where you sense the things. So smell you sense through the nostrils. Right. Suppose if you are sitting in any of the meditation and you are trying to meditate. In the meditation, you don't try actually. You are meditating and you are very ambitious about any particular taste. Suppose a smell. Take as a smell. So you are just meditating, and in between there is something is cooked which you like too much. Too much in the sense there is no limit for liking. So you like, so that smell comes, wow, super smelly. Then till you simply come outside. So where is the sadhana? Where is the meditation? That is not possible. So here, Hatha yogis do this to have control over their sense organs. So while doing this bandhas also very important. These bandhas will help them to withdraw their sense organ from any object. It can be taste, it can be scenery, watching anything, it can be tasting, it can be touch, it can be anything. Okay? Rasana and Vasana, these two are the dangerous things which ties you, which holds you back from the sadhana. Okay? These two are. One is Rasana, another one is Vasana, right? Let us move further. चलो आगे बढ़ते हैं. Benefits of bandha. So we are not taking any individual thing here. We are covering the bandhas itself is one concept. So bandha, physical benefits. What are the physical benefits? When the bandhas are applied, they activate muscle tissues and stimulate the organs and glands of the respective region. So this is one of the powerful gland because it is responsible for the hormones, right? For example, the application of Mula Bandha activates the pelvic floor muscle. It tones them and improves their functioning. How do you look? So if any problem in this in that part of body will be eliminated. So energetic benefit, bandhas also stimulate the chakras by locking the energy around them. Now chakras are very important. Chakras are junctions of your body where the power flows through these junctions. So that should not be blocked. The junction should not be blocked, right? If the junction is blocked, then traveling will be difficult. So similarly will happen. If you do that, then all the chakras of your body will be activated. So when the chakras are stimulated by using bandhas, prana circulates more efficiently as a traffic flows. No, similarly, the prana circulates efficiently throughout the body, resulting in improved physical and mental vitality. So why there is some mental issues and health issues, why it will happen? The physical issues due to the energy blockages in the body. If energy is blocked in the heart region, the heart attack or sun stance will be put. Why? Because the flow is not there. Something is there which is blocking Something is there which is not allowing the prana to flow properly, right? That is the reason we don't breathe properly and we go to the heart vascular disorders. So the next is, what is next? Okay, next is thank you. So this is end. The bandhas are end. This is actually a very big topic. Only small topic from the what do you say? Hatha yoga I have taken. There are some other topics. So we will be talking. Now, is there any doubt? Let me know how it is to be performed and all. I have already explained. If any doubts, there are some more things I'll be explaining you. But let me know any doubts, which is not mentioned in the slides. I'll be explaining.
ಮ್ಯಾಮ್
See,
ಇದ್ರ
uh,
ಬೆನಿಫಿಟ್ಸ್ ಬಂದ್ಬಿಟ್ಟು ಲೈಕ್ ಸೆನ್ಸ್ ಆರ್ಗನ್ಸ್ ಮೇಲೆ ಕಂಟ್ರೋಲ್ ಮಾಡೋದು ಅಷ್ಟೇ ಅಲ್ಲ?
ಕಂಪ್ಲೀಟ್ ಎಂಟೈರ್ ಥಿಂಗ್ ಬಹಳಷ್ಟು ಆಗುತ್ತೆ. ಅಲ್ಲಿ ಏನ್ ಹೇಳಿದ್ದು ಫಿಸಿಕಲ್ ಅಂಡ್ ಮೆಂಟಲ್. ಫಿಸಿಕಲ್ ಅಂತಂದಾಗ ಏನೇನಾಗುತ್ತೆ, ಫಿಸಿಕಲ್ಗೆ ಲಿಮಿಟೇಷನ್ಸ್ ಇಲ್ಲ ನೋಡ್ರಿ. ಫಿಸಿಕಲ್ಗೆ ನಾವು ಒಂದೇ ಇದ್ರ ಸೆಂಟೆನ್ಸ್ ಅಲ್ಲಿ ಆರ್ಗನ್ಸ್ ಇದೆ. ವಾಟ್ ಆರ್ ದ ಡಿಫರೆಂಟ್ ಆರ್ಗನ್ಸ್ ಇಫ್ ಯೋರ್ ಬಾಡಿ? ಪೆಲ್ವಿಕ್ ಫ್ಲೋರ್ ಅಂಡ್ ದ ಇಫ್ ಇಟ್ ವಿಲ್ ಗೋ ಅಪ್ವರ್ಡ್ ದ ಅಬ್ಡಾಮಿನ್ ರೀಜನ್, ಮೇಲ್ ರೀಪ್ರೊಡಕ್ಟಿವ್ ಸಿಸ್ಟಮ್, ಫಿಮೇಲ್ ರೀಪ್ರೊಡಕ್ಟಿವ್ ಸಿಸ್ಟಮ್. ಸ್ವಲ್ಪ ಮೇಲೆ ಹೋದಾಗ ಲಾರ್ಜ್ ಇಂಟೆಸ್ಟೈನ್, ಸ್ಮಾಲ್ ಇಂಟೆಸ್ಟೈನ್, ರೈಟ್? ಅಕ್ಕಪಕ್ಕನೆ. ಮತ್ತೆ ಸ್ವಲ್ಪ ಮೇಲೆ ಹೋದಾಗ ಸ್ಟಮಕ್ ರೀಜನ್, ದಟ್ ಈಸ್ ಡೈಜೆಸ್ಟಿವ್ ಸಿಸ್ಟಮ್. Digestive system will improve. The liver, kidney, pancreas, the function of this, because the muscles uh, of the different organs will be improved. So that is important. And little up the ರೆಸ್ಪಿರೇಷನ್ ಚೆನ್ನಾಗಿದ್ರೆ ಚೆನ್ನಾಗಾಗತ್ತಲ್ಲ, ಎಲ್ಲವೂ ಸರಿ ಹೋಗುತ್ತೆ. ಬ್ರೀದಿಂಗ್ ಚೆನ್ನಾಗಿ ಮಾಡೋದಕ್ಕಾಗಿದ್ರೆ ಮಾತ್ರ ನಾವು ಬದುಕೋಕ್ ಸಾಧ್ಯ. ಸೊ ಬ್ರೀದಿಂಗ್ and the capacity of your respiration will improve. No bacteria, no any kind of virus will affect you. So you'll be healthier. If you just travel through any infected area also, you will not be affected. Why? Because your different organs has the capacity to kill that. So it will be able to handle it. That is one thing. And yes, Jalandhar Bandha, this is ultimate. This is the, what I said, this is a filter of your body. So whatever goes inside body, it will go through this only, no? Majorly, it will go through the mouth or the nostrils and passes from here. So if this is strong, then it will be activated. ಮೆಂಟಲ್ ಇಶ್ಯೂ ಯಾವಾಗ ಬರುತ್ತೆ? ನಮ್ಮ ಶರೀರದಲ್ಲಿ ಒಂದೇನೋ ಸಮಸ್ಯೆ ಇದ್ದಾಗ ಅದು ಒಂದು ಬರುತ್ತೆ, ಕರೆಕ್ಟಾ? ಸಪೋಸ್ ನಿಮಗೆ ಹೊಟ್ಟೆ ನೋವಿದೆ ಅಥವಾ ಮತ್ತೇನೋ ಬೆನ್ನು ನೋವಿದೆ, ಬಾಡಿ ಪೇನ್ ಅಂತ ಇದ್ದೇ ಇದೆ. ಬಾಡಿ ಜೊತೆ ನಿಮ್ಮ ಸ್ಟೇಟ್ ಆಫ್ ಮೈಂಡ್ ವಿಲ್ ಆಲ್ಸೋ ಚೇಂಜ್. ಯು ವಿಲ್ ಜಸ್ಟ್ ಬಿ ಇರಿಟೇಟೆಡ್, ಯು ವಿಲ್ ಹ್ಯಾವ್ ಆಂಗರ್, ಯು ವಿಲ್ ಬಿ ಸ್ಟ್ರೆಸ್ಡ್, ಯು ವಿಲ್ ಬಿ ಡಿಪ್ರೆಸ್ಡ್. ಸೊ ಇವೆಲ್ಲ ಸಿಸ್ಟಮ್ ಚೆನ್ನಾಗಾದಾಗ ಮೆಂಟಲ್ ಸಿಸ್ಟಮ್ ತಾನಾಗೆ ಚೆನ್ನಾಗಾಗತ್ತೆ. ಹೌದೋ ಇಲ್ಲೋ? ಓಕೆ, ನಾಟ್ ಓನ್ಲಿ ಸೆನ್ಸ್ ಆರ್ಗನ್ಸ್. ಸಾಧನೆಯ ದಾರಿಯಲ್ಲಿ ನೋಡಿದಾಗ ಬಂಧ ಮತ್ತು ಮುದ್ರಾಸ್ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಯಾವುದಕ್ಕೆ? ಹಠಯೋಗಿಗಳಿಗೆ. ಹಠಯೋಗಿಗಳ ಒಂದೇ ಉದ್ದೇಶ ಪರಮಾತ್ಮನ ಕಡೆಗೆ ತನ್ನನ್ನು ತೆಗೆದುಕೊಂಡು ಹೋಗೋದು. ಸೊ ಪರಮಾತ್ಮನ ಕಡೆಗೆ ತೆಗೆದುಕೊಂಡು ಹೋಗೋದಕ್ಕೆ ಏನೇನು ಅಡ್ಡಿಗಳಾಗುತ್ತೆ, ಆ ಅಡ್ಡಿಗಳನ್ನ ತೆಗೆದು ಹಾಕೋದಕ್ಕೆ ಈ ಪ್ರಾಕ್ಟೀಸ್ಗಳು ತುಂಬಾ ಚೆನ್ನಾಗಿದೆ. ಎಸ್.
Ma'am, in case of women, can they perform all the bandhas during menstrual
Definitely,
cycles?
men should perform. If you want to have a happy life, I wanted to explain that example, that benefit. You asked the question. Men and women should practice this. Why? To keep your marital life healthy, marital life happy, healthy and happy. These two things has to be there. If your healthy is there, happiness is there. If it is not there, then it is of no use, no? So healthy and happy both will be maintained here. So how do you know how? Do you know how? Anybody knows how? Yes, Manoj
ma'am.
has to
ಮ್ಯಾಮ್
huh.
we can control our like reproductive organs also, no? Like sense, like
No, not
desire also.
control. You can improve the function of your reproductive organ.
Ma'am, sometimes it also reduces
Hmm. I'll talk. I'll talk
and
about it.
have control and yeah, no, like I was practicing it from 1.5 year, ma'am. Like in
Hmm.
meditation.
See, okay, you asked this question. Let me explain. I don't feel hesitated. Sometimes what happens, rasana, I said, and vasana. Rasana is a taste. Vasana is a sexuality. So you feel to have sex. ಸೊ ಕೆಲವೊಬ್ಬರಿಗೆ ತುಂಬಾ ಇರುತ್ತೆ ಅಂತಂದ್ರೆ ಕಂಟ್ರೋಲ್ ಮಾಡೋದಕ್ಕಾಗೋದಿಲ್ಲ. ಮನೋಜ್ ವಾಸ್ ಸೇಯಿಂಗ್ ಕಂಟ್ರೋಲ್, ಎಸ್, ಕಂಟ್ರೋಲ್ ಮಾಡೋದಕ್ಕಾಗೋದಿಲ್ಲ. ಸೊ ಅಂಥ ಸಂದರ್ಭದಲ್ಲಿ ಈ ಥರದ ಬಂಧ ಮಾಡಿದಾಗ ಇಟ್ ಈಸ್ ಇನ್ ಯುವರ್ ಹ್ಯಾಂಡ್. It is in your hand. You can activate at any point of time whenever you want to have. Yes, ತುಂಬಾ ಎಫೆಕ್ಟಿವ್ ಆಗಿ, ತುಂಬಾ ಎಫಿಷಿಯಂಟ್ ಆಗಿ, ಸೊ ದಟ್ ಸಿಚುವೇಶನ್ ವಿಲ್ ಬಿ ದ ಮೆಮೊರೇಬಲ್ ಸಿಚುವೇಶನ್ ಫಾರ್ ದ ಮ್ಯಾರಿಡ್ ಪೀಪಲ್. ಟೀಕೆ. ಸೊ ಆ ಥರ ಈಗ ಕೆಲವೊಬ್ಬರಿಗೆ ಅದನ್ನು ಕಂಟ್ರೋಲ್ ಕೂಡ ಮಾಡೋದಕ್ಕಾಗತ್ತೆ. ಹ್ಮ್. ಈಗ ನೀವು ನನಗೆ ಕೇಳಿದ್ರೆ ಐ ಹ್ಯಾವ್ ಕಂಟ್ರೋಲ್ ಓವರ್ ಇಟ್. I don't feel shy to say because all of you are married. Chaitra ma'am agli, Nikhila ma'am agli, Sindhu ma'am agli, except Manu sir. Manu sir, it will help you in your future. ಡೆಫಿನೆಟ್ಲಿ ಇವಾಗಂತೂ ತುಂಬಾ ಜನ ತಪ್ಪು ಮಾಡೋದು ಅಥವಾ ಅಪರಾಧಗಳಾಗೋದು ಇದರಿಂದಾನೆ. ಹೌದೋ ಇಲ್ಲೋ ಸಮಾಜದಲ್ಲಿ ಗ್ಯಾಂಗ್ ರೇಪ್ ಆಗಲಿ ಅಥವಾ ಯಾವುದೋ ಇಂಡಿವಿಜುವಲ್ ರೇಪ್ ಆಗಲಿ ಎದರಿಂದ ಆಗತ್ತೆ? ಅವರಿಗೆ ಅದ್ರ ಮೇಲೆ ಕಂಟ್ರೋಲ್ ಇರೋದಿಲ್ಲ. ಮತ್ತೆ ಆ ಸಂದರ್ಭದಲ್ಲಿ ಆ ವಾಸನೆ ಮೇಲೆ ಆ ಸೆಕ್ಷುಯಾಲಿಟಿ ಇದೆಲ್ಲ ಅದ್ರ ಮೇಲೆ ಕಂಟ್ರೋಲ್ ಆಗೋದಿಲ್ಲ. ಎದುರು ಯಾರಿದ್ದಾರೆ ಅನ್ನೋದು ಕೂಡ ನೋಡೋದಿಲ್ಲ. ಪಾಪ ವೃದ್ಧರಿದ್ದಾರೋ ಅಥವಾ ಎಂಗೇಜ್ದವರಿದ್ದಾರೋ ತುಂಬಾ ಚಿಕ್ಕ ಮಗು ಇದೆಯೋ ಅದು ನೋಡೋದಿಲ್ಲ. ಕಾರಣ, ಯಾಕಂದ್ರೆ ಮುಳುಗಿರ್ತಾರೆ ಅದರಲ್ಲಿ. ಸೊ ಅಂಥ ವಿಷಯಗಳನ್ನ ಕಂಟ್ರೋಲ್ ಮಾಡೋದು ಹೇಗೆ? ಇಂಥ ಬಂಧಗಳಿಂದ. ಅದರ ಮೇಲೆ ಮಾಸ್ಟರಿ ಪಡೆಯೋದು ಹೇಗೆ? ಇಂಥ ಬಂಧಗಳಿಂದ. ಸೊ ಇದು ನಿಮ್ಮ ಕೈಯಲ್ಲಿದೆ. ಅವಾಗ ನಿಮಗೆ ರಿಯಲೈಸ್ ಆಗುತ್ತೆ ನಾನ್ ಮಾಡೋದು ಸರಿ ಇದೋ ತಪ್ಪಿದೋ. ಅಲ್ಲಿ ಕಂಟ್ರೋಲ್ ಇರೋದಿಲ್ಲ ಅಂದ್ರೆ ಗುರ್ತಿದ್ರು ಇರೋದಿಲ್ಲ, ಅವ್ರಿಗೆ ರಿಯಲೈಸೇ ಆಗೋದಿಲ್ಲ ನಾನು ಏನ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಅನ್ನೋದೇ ರಿಯಲೈಸ್ ಆಗೋದಿಲ್ಲ. ಅದರಿಂದನೇ ಈ ಅಪರಾಧಗಳಾಗೋದು. ಅದಕ್ಕೆ ಯೋಗ ಅನ್ನೋದು ಜೀವನದಲ್ಲಿ ತಂದಾಗ ಸಮಾಜದಲ್ಲಿ ಅಪರಾಧಗಳೇ ಇರೋದಿಲ್ಲ. ಯಾಕಂತಂದ್ರೆ ಎದ್ರ ಮೇಲೆ ಹೇಗೆ ಕಂಟ್ರೋಲ್ ಪಡಬೇಕು ಅನ್ನೋದ್ರ ಹೇಳ್ಕೊಡೋದೇ ಯೋಗ. ಜೀವನ ಶೈಲಿಯನ್ನು ಹೇಳ್ಕೊಡೋದೇ ಯೋಗ. ನಮ್ಮ ಥಾಟ್ ಪ್ರೊಸೆಸ್ ಹೇಗಿರ್ಬೇಕು ಅನ್ನೋದು ಹೇಳ್ಕೊಡೋದೇ ಯೋಗ. ನಾವು ತಗೋರುವಂತ ಆಹಾರ ಹೇಗಿರ್ಬೇಕು ಅನ್ನೋದು ಹೇಳೋದೇ ಯೋಗ. ಅದು ಎಲ್ಲಿ ಪುಸ್ತಕದಲ್ಲಿ, ಎಲ್ಲವೂ ಪುಸ್ತಕದಲ್ಲಿ ಸಿಗ್ಲಿಕ್ಕಿಲ್ಲ ನಿಮ್ಗೆ. ನೀವ್ ಯಾವಾಗ ಮಾಡ್ತಿರೋ ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ರಿಯಲೈಸೇಷನ್. ಸೊ ರಿಯಲೈಸ್ ಮಾಡಿಸುತ್ತೆ. ಅದು ಸೆಲ್ಫ್ ರಿಯಲೈಸೇಷನ್ ಹೈಯರ್ ಆಗ್ಬೋದು ಅಥವಾ ಶಾರೀರದ ಲೆವೆಲ್ ಆಗ್ಬೋದು, ಮನಸ್ಸಿನ ಲೆವೆಲ್ ಅಲ್ಲಿ ಆಗಬಹುದು, ಯಾವುದೇ ಲೆವೆಲ್ ಅಲ್ಲಿ ಇರಲಿ. ಅದು ನಿಮಗೆ ಹೇಗೆ ಅದ್ರ ಮೇಲೆ ಮಾಸ್ಟ್ರಿ ಹೇಗೆ ಪಡಿಬೇಕು ಅನ್ನೋದನ್ನ ಕಲಿಸ್ಕೊಡುತ್ತೆ. ನಾನು ಹೇಳೋದು ಅರ್ಥ ಆಗ್ತಾ ಇದೆಯಾ? ಈಗ ಇದು ಆಯ್ತು, ಯು ಆರ್ ಅ ಯಂಗ್. So I hope you don't waste your urja sir, Manoj sir, because you are still not married, and keep it for your wife. ಈಗ ಈ ಊರ್ಜಾ ಶಕ್ತಿಯ ಕ್ಷೀಣತೆ ಎದರಿಂದ ಆಗುತ್ತೆ? ಇದರ ಮೇಲೆ ಕಂಟ್ರೋಲ್ ಇಲ್ಲದೆ ಕಾರಣಕ್ಕೆ ಆಗತ್ತೆ. ಸೊ ಕೆಲವೊಂದ್ಸರಿ ಅದಕ್ಕೆ ಒಂದೊಂದ್ಸರಿ ಬಹಳಷ್ಟು ಸರ್ತಿ ಎಲ್ಲೋ ಒಂದು ಅದರಲ್ಲೋ ಒಂದು ಸೀರಿಯಲ್ ಅಲ್ಲೋ ಅದರಲ್ಲೋ ಕೇಳ್ತಾ ಇರ್ತೀನಿ, ವರ್ಜಿನ್ 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 ಅನ್ನೋದೇ ಗೊತ್ತಿರ್ಲಿಲ್ಲ ನನಗೆ ಬಹಳಷ್ಟು ದಿವಸ ತನಕ. ವರ್ಜಿನ್ ಹಂಗಂದ್ರೆ ಏನು ಅನ್ನೋದು ಗೊತ್ತಿರ್ಲಿಲ್ಲ. ಅದನ್ನ ನಮ್ಮ ಯಜಮಾನರಿಂದ ಗೊತ್ತಾಗ್ತದೆ, ಬಿಕಾಸ್ ಐ ಆಸ್ಟ್ ಹಿಮ್. ಟೀಕೆ. ಸೊ ಈ ಪ್ರಶ್ನೆಗಳು ಬರುತ್ತೆ. ಯಾಕೆ? ಅವ್ರು ತನ್ನ ವೀರ್ಜಾ ಶಕ್ತಿನ, ಅಂಥವ್ರಿಗೆ ಮಾತ್ರ ಗೊತ್ತಿರ್ಬೇಕು ಅಂತ ಶಬ್ದಗಳು, ಅಂತ ಕೆಲಸ ಮಾಡೋರಿಗೆ ಮಾತ್ರನೇ ಗೊತ್ತಿರ್ಬೇಕು. ಹೌದೋ ಇಲ್ಲೋ? ಸೊ ಆ ಊರ್ಜಾ ಶಕ್ತಿಯನ್ನ ಕ್ಷೀಣ ಮಾಡ್ತಾ ಇರ್ತಾರೆ, ನಾಶ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಇದು ಒಂದು ರೀಸನ್. ಸೊ ಇದು ನಿಮಗೆ ಆ ಊರ್ಜಾ ಶಕ್ತಿಯನ್ನ ಸೇವ್ ಮಾಡ್ಬಿಟ್ಟು ನಿಮ್ಮ ಪಾರ್ಟ್ನರ್ಗೆ ಕೊಡೋದಕ್ಕೆ ನಿಮ್ಗೆ, ಅಂದ್ರೆ ಇದು ನನ್ನ ಪಾರ್ಟ್ನರ್ಗೆ ಕೊಡ್ಬೇಕು, ನಾನು ಎಲ್ಲೆಲ್ಲೋ ವೇಸ್ಟ್ ಮಾಡೋದಲ್ಲ. ಅಂಡ್ ದಿಸ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಯೂಸ್ಡ್ ಫಾರ್ ಅ ಪರ್ಟಿಕ್ಯುಲರ್ ರೀಸನ್. ಇದು ಕೊಟ್ಟಿದ್ದು ಭಗವಂತ ಸಿಕ್ಕಂಗೆ ಯೂಸ್ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ಟು ನಿನ್ನ ನಿಜವಾದ ಸ್ವರೂಪನೇ ಮರಿಬೇಕಂತಲ್ಲ. ಇದನ್ನ ಕೇವಲ ನಿಮ್ಮ ವಂಶ ವೃದ್ಧಿಗಾಗಿ ಮಾತ್ರ ಮಾಡೋದು ಇದನ್ನ. Actually, this has to be done only for the growth of the family or the generation. ಅಷ್ಟೇ. that is only the work of it. ಅದಕ್ಕೆ ಬಿಟ್ಟು ಇಲ್ಲ. ನೀವು ಋಷಿಮುನಿಗಳು ನೋಡ್ರಿ, ಅವ್ರ ದಿನಾ ಆ ಪ್ರಕ್ರಿಯೆನ ಮಾಡ್ತಿದ್ರ? ನೋ, ಓನ್ಲಿ ಫಾರ್ ಜನರೇಷನ್ ಆಫ್ ದ ವಾಟ್ ಯು ಸೇ ಜನಸಂಖ್ಯೆ ಅನ್ನೋದಕ್ಕಿಂತಲೂ ವಂಶವೃದ್ಧಿಗಾಗಿ ಮಾತ್ರ ಅದನ್ನ ಮಾಡ್ತಿದ್ರು ಹೊರತು ಬೇರೆ ದಿನ ಬೆಳಿಗ್ಗೆ ದಿನ ಸಾಯಂಕಾಲ ಯಾವಾಗಂದ್ರೆ ಅವಾಗ ಮಾಡ್ತಿರ್ಲಿಲ್ಲ. ಟೀಕೆ. ದಿಸ್ ಇಸ್ ಒನ್ ರೀಸನ್. ನಾ ಫಾರ್ ಮ್ಯಾರಿಡ್ ಪೀಪಲ್, ಈಗ ನಿಮಗಿದು ಹೇಗೆ ಹೆಲ್ಪ್ ಆಗತ್ತೆ ಅಂತಂದ್ರೆ, ಬಹಳಷ್ಟು ಸಂಬಂಧಗಳು ನೀವು ಒಂದಿಲ್ಲ ಇನ್ನೊಂದು ರೀತಿಯಲ್ಲಿ ಡೈವೋರ್ಸ್ಗಳು ಎದಕ್ಕಾಗತ್ತೆ, ಬಹಳಷ್ಟು ವಿಷಯದಲ್ಲಿ ಡಿವೋರ್ಸ್ಗಳು ಎದಕ್ಕಾಗತ್ತೆ, ಇದು ಒಂದು ರೀಸನ್ ಆಗುತ್ತೆ. ಅದರಲ್ಲಿ ಬಹಳಷ್ಟು ಕಾರಣಗಳಲ್ಲಿ ಇದು ಒಂದು ರೀಸನ್. ಯಾಕಂತಂದ್ರೆ ಹೆಂಡತಿಗಾದ್ರೂ ಕೊರತೆ ಇರುತ್ತೆ, ಹೆಂಡತಿ ಆದ್ರೂ ಸಪೋರ್ಟ್ ಮಾಡೋದಕ್ಕಿಲ್ಲ, ಅಥವಾ ಗಂಡನಿಗಾದ್ರೂ ಕೊರತೆ ಇರುತ್ತೆ. ಸೊ ನಿಮ್ಮ ವೈವಾಹಿಕ ಜೀವನವನ್ನ ಸುಖಕರವಾಗಿ ಇಡಬೇಕು ಅಂತಂದ್ರೆ ಈ ಆರ್ಗನ್ ಅನ್ನ ಆ ತುಂಬಾ ಆಕ್ಟಿವ್ ಆಗಿ ಇಟ್ಕೋಬೇಕು, ಚೆನ್ನಾಗಿ ಇಟ್ಕೋಬೇಕು. ಸೊ ಅದು ನಿಮ್ಮ ಕೈಯಲ್ಲಿರ್ಬೇಕು. ನೀವು ಯಾವಾಗ ನೀವು ಸಂತೋಷ ಪಡ್ಬೇಕಂತಿದ್ರು ಅವಾಗ ಮಾತ್ರ ಅದು ಆಕ್ಟಿವ್ ಆಗೋ ಹಾಗೆ ಅದನ್ನ ಆಗತ್ತೆ. ಅದು ದಟ್ ಈಸ್ ಡೆಫಿನೆಟ್ಲಿ ವಿಲ್ ಹ್ಯಾಪನ್ ಅಂಡ್ ಇಟ್ ಈಸ್ ಮೈ ಅಂಡರ್ ಕಂಟ್ರೋಲ್. ಇಫ್ ಯು ಆಸ್ಕ್ ಮಿ ಪರ್ಸನಲಿ, ಎಸ್ ಡೆಫಿನೆಟ್ಲಿ ಇಟ್ ಈಸ್ ಮೈ ಕಂಟ್ರೋಲ್. ठीक है, this is one reason, being happy. Now for generating a child or producing a child, it will help you. The quality of a child will be more. ನಾವು ಪಡೆದಿದ್ದಂತಹ ಮಕ್ಕಳು ಇವಾಗ ಏನ್ ಹುಟ್ಟಿದ ತಕ್ಷಣನೇ ನೋಡ್ರಿ ಏನಾದ್ರೂ ಒಂದಾಗಿರುತ್ತೆ. ಜ್ವರ ಆದ್ರೆ ಅದು ಪದೇ ಪದೇ ಬರ್ತಾ ಇರುತ್ತೆ, ಮತ್ತೇನಾದ್ರೂ ಆಗ್ತದೆ ಇರುತ್ತೆ, ಹೆಲ್ತ್ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಅರ್ಥ ಆಯ್ತಲ್ಲ ನಾನು ಹೇಳ್ತಾ ಇರೋದು? ಸೊ ಇಲ್ಲ ಏನಾಗುತ್ತೆ, ನಿಮ್ಮ ಕ್ವಾಲಿಟಿ ಆಫ್ ಅ ಸ್ಪರ್ಮ್ ಅಂಡ್ ಅ ಕ್ವಾಲಿಟಿ ಆಫ್ ಅ ಎಗ್ will be healthy. It will good. So when you have a child, you will not have a diseased child. Getting my point? Diseased child. So it will be physically strong and mentally definitely. So that will also be there. ಅರ್ಥ ಆಯ್ತಾ? ಇನ್ನು ಕೆಲವರಿಗೆ ರೀಪ್ರೊಡಕ್ಟಿವ್ ಸಿಸ್ಟಮ್ ಚೆನ್ನಾಗಿರೋದಿಲ್ಲ. ಅಂದ್ರೆ ಸ್ಪರ್ಮ್ ಅಲ್ಲಿ ಅದ್ರ ಕೊರತೆ ಇರುತ್ತೆ, ಅಥವಾ ಎಗ್ ಅಲ್ಲಾದ್ರೂ ಕೊರತೆ ಇರುತ್ತೆ. ಸೊ ಎಗ್ ಚೆನ್ನಾಗಿ ಬೆಳೆದಿರ್ಲಿಕ್ಕಿಲ್ಲ, ಅದು ಒಂದು ರೀಸನ್. ಅಥವಾ ಸ್ಪರ್ಮ್ ಕ್ವಾಲಿಟಿ ಇರ್ಲಿಕ್ಕಿಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ಗರ್ಭಧಾರಣೆ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ಗರ್ಭಧಾರಣೆ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ ಅಂತಂದ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ಯು ಶುಡ್ ಪ್ರಾಕ್ಟಿಸ್ ದಿಸ್, ಸೊ ದ್ಯಾಟ್ your organ, that is reproductive organ, be activated. So it will be able to produce a quality. ಅದೇನೇ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ರು ಸೊ ಕ್ವಾಲಿಟಿ ಇರುತ್ತೆ ಅಂಡ್ ಇಟ್ ವಿಲ್ ಬಿ ಸ್ಟ್ರಾಂಗ್. ಗರ್ಭಧಾರಣೆ ಆದ ತಕ್ಷಣ ಸ್ವಲ್ಪ ಒಂದೇನೋ ಹೆವಿ ಕೆಲಸ ಮಾಡಿದ್ರೆ ಅಬೌಟ್ ಆಗ್ಬಿಡುತ್ತೆ. ವೈ? ಬಿಕಾಸ್ ಯುವರ್ ಯೂಟ್ರಸ್ ಈಸ್ ನಾಟ್ ಸೋ ಸ್ಟ್ರಾಂಗ್, ಇಟ್ ಈಸ್ ನಾಟ್ ಏಬಲ್ ಟು ಹೋಲ್ಡ್ ಇಟ್ ಪ್ರಾಪರ್ಲಿ. ಸೊ ಮೇಕ್ ಯುವರ್ ಯೂಟ್ರಸ್ ಸ್ಟ್ರಾಂಗ್, ಯು ನೀಡ್ ಟು ಪರ್ಫಾರ್ಮ್ ದಿಸ್. ಅರ್ಥ ಆಯ್ತಾ? ಡೌಟ್ ಇದೆಯಾ? ಸಾಕಿಷ್ಟೇ ಹೇಳೋದು ಇದ್ರ ಬಗ್ಗೆ.
ಅಂದ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅವರು ಲೈಕ್ ಫಸ್ಟ್ ಸ್ಟಾರ್ಟಿಂಗ್ ಅಲ್ಲಿ ಮಾತ್ರ ಮಾಡ್ಬೇಕಾ ಮ್ಯಾಮ್ ಈಗ?
ಹಾ, ಪ್ರೆಗ್ನೆಂಟ್ ಆದ್ಮೇಲೆ ಮಾಡಬಾರ್ದು. ಯಾಕೆ ಹೇಳ್ರಿ?
ಲೈಕ್ ಅದು ಇನ್ಫಾರ್ಮೇಶನ್ ಬಂದಾದ್ಮೇಲೆ ಮಾಡ್ಬಾರ್ದಲ್ಲ ಮ್ಯಾಮ್?
ಹಾ, ಮಾಡಬಾರ್ದು. ಇನ್ಫಾರ್ಮೇಶನ್ ಕನ್ಫರ್ಮ್ ಆದ್ಮೇಲೆ. ಕನ್ಫರ್ಮ್ ಆಗುತ್ತೆ ಅದು 1 month. ಸಪೋಸ್ ಮೆನ್ಸ್ಟ್ರುಯೇಷನ್ ಡೇಟ್, ಈಗ ನಂದೇ ಮೆನ್ಸ್ಟ್ರುಯೇಷನ್ ಡೇಟ್ 26 ಮಾರ್ಚ್ ಇತ್ತಂತ ತಿಳ್ಕೊಡ್ರಿ. 26 ಫೆಬ್ರವರಿ ಇತ್ತು ನಂದು. ನೆಕ್ಸ್ಟ್ 26 ಫೆಬ್ರವರಿಗೆ ಆಗ್ಬೇಕಾಗಿತ್ತು, ಆಗಿಲ್ಲ. ದಟ್ ಮೀನ್ಸ್ ಅಂಡ್ ಅವಾಗ ನಾವು ಕನ್ಸೆಪ್ಷನ್ಗೆ ಟ್ರೈ ಮಾಡಿದೀವಿ ಅನ್ಕೊಳ್ಳಿ. ಸೊ ಕನ್ಫರ್ಮ್ ಆಗಿದ್ರೆ ಆ 26ಗೆ ಬರೋದಿಲ್ಲ, ಮಿಸ್ ಆಗ್ಬಿಡುತ್ತೆ. ಅಂಡ್ ಯು ವಿಲ್ ಹ್ಯಾವ್ ಸಮ್ ಡಿಸ್ಕಂಫರ್ಟ್ ಇನ್ ಯುವರ್ ಬಾಡಿ. ಚೇಂಜಸ್ ಆಗುತ್ತೆ, ಹೆಣ್ಮಕ್ಳಿಗೆ ಚೇಂಜಸ್ ಆಗುತ್ತೆ. ಓಕೆ, ಬ್ರಿಸ್ಟ್ ಅಲ್ಲಿ ಆಗ್ಲಿ ಅಥವಾ ಸೊಂಟದ ಭಾಗದಲ್ಲಾಗ್ಲಿ ಎಲ್ಲೋ ಒಂದು ಚೇಂಜಸ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಶಿ ವಿಲ್ ಬಿ ಅಬ್ಸರ್ವಿಂಗ್ ಇಟ್. ಅವಳಿಗೆ ಗೊತ್ತಾಗ್ಬಿಡ್ತಾ ಇರುತ್ತೆ ಏನೋ ಚೇಂಜ್ ಆಗ್ತಾ ಇದೆ ಬಾಡಿಯಲ್ಲಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ಇಫ್ ಶಿ ಹ್ಯಾಸ್ ದಟ್ ಇನ್ ಹರ್ ಮೈಂಡ್ ದಟ್ ಐ ಹ್ಯಾವ್ ಟ್ರೈಡ್ ಫಾರ್ ದ ಪ್ರೆಗ್ನೆನ್ಸಿ, ಶಿ ವಿಲ್ ಓನ್ಲಿ ಬಿ ಕನ್ಫರ್ಮ್. ಬೇರೆ ಯಾರಿಗೂ ಗೊತ್ತಾಗೋದಿಲ್ಲ, ಅವಳಿಗೆ ಮಾತ್ರ ಗೊತ್ತಿರುತ್ತೆ ಓಕೆ ನಾನು ಪ್ರೆಗ್ನೆಂಟ್ ಇದ್ದೀನಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ಬೇರೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ ಅಂಟಿಲ್ ಅಂಡ್ ಅನ್ಲೆಸ್ ಶಿ ಟೆಲ್ಸ್. ಸೊ ಆಫ್ಟರ್ ನೋಯಿಂಗ್ ದಟ್ ಶಿ ಶುಡ್ ನಾಟ್ ಪರ್ಫಾರ್ಮ್. ಹಾ, ಇನ್ನು ಕೆಲವೊಂದ್ ಸರ್ತಿ ಹೇಳ್ತೀನಿ, ಈ ಪ್ರಶ್ನೆ ಕೇಳಿದ್ರೆ ಅಂತ ಉತ್ತರ ಹೇಳ್ತೀನಿ. ಇನ್ನು ಕೆಲವೊಂದ್ ಸರ್ತಿ ಹೆಣ್ಮಕ್ಳಿಗೆ ನಾನು ಹೇಳಿದೆ ಪೈಲ್ಸ್ ಸಮಸ್ಯೆ ಇರುತ್ತೆ, ಹೌದೋ ಇಲ್ಲೋ? ಕಾರಣ ಪ್ರೆಷರ್ ಬೀಳುತ್ತೆ, ಪೆಲ್ವಿಕ್ ಫ್ಲೋರ್ ಮೇಲೆ ಪ್ರೆಷರ್ ಬೀಳುತ್ತೆ. ಮಗು ಬೆಳೆದ ಹಾಗೆ ಕೆಳಗಡೆ ಪ್ರೆಷರ್ ಬೀಳ್ತಾ ಹೋಗುತ್ತೆ. ಸೊ ದ ಮಸಲ್ಸ್ ಒಳಗಿರುವಂತಹ ಭಾಗ ಹೊರಗಡೆ ಬರೋದಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಯ್ತು. ದಟ್ ಇಸ್ ಓನ್ಲಿ ದ ಪೈಲ್ಸ್. ಆದರೆ ಆ ಸಮಸ್ಯೆ ಆಗಬಾರ್ದು, ಅದು ಸ್ಟ್ರಾಂಗ್ ಇರಬೇಕು. ಅಂತ ಸಮಸ್ಯೆ ಆಗಬಾರ್ದು ಅಂದ್ರೆ ಏನ್ ಮಾಡ್ಬೇಕು? ಶಿ ಕ್ಯಾನ್ ಆಲ್ಸೋ ಪರ್ಫಾರ್ಮ್ ದ ಬಂಧ, ಬಟ್ ಐ ಆಮ್ ಸೇಯಿಂಗ್ ಬಟ್. ಓಕೆ, ಬಟ್ ಹೇಗೆ? ಶಿ ಶುಡ್ ನಾಟ್ ಹೋಲ್ಡ್ ಹರ್ ಬ್ರೀದ್ ಇನ್ ಅಂಡ್ ಔಟ್. ಶಿ ಸಿಂಪ್ಲಿ ಶುಡ್ ಬ್ರೀದ್ ನ್ಯಾಚುರಲಿ, ಸಹಜವಾಗಿನೇ ಬ್ರೀದ್ ಮಾಡ್ತಾ ಇರಬೇಕು. ಆ ಪೆಲ್ವಿಕ್ ಫ್ಲೋರ್ ನ ಕಾಂಟ್ರಾಕ್ಷನ್ ಮತ್ತೆ ರಿಲೀಸ್, ಕಾಂಟ್ರಾಕ್ಷನ್ ಮತ್ತೆ ರಿಲೀಸ್, ಈ ರೀತಿ ಮಾಡ್ತಾ ಇರಬೇಕು. ಟೈಟ್ ರಿಲೀಸ್, ಟೈಟ್ ರಿಲೀಸ್. ದಟ್ ಕ್ಯಾನ್ ಬಿ ಡನ್ ಬೈ ಬ್ರೀದಿಂಗ್ ನಾರ್ಮಲಿ. ಇಫ್ ಯು ಟ್ರೈ, ಆಲ್ ಆಫ್ ಯು ಪ್ಲೀಸ್ ಟ್ರೈ ಅಂಡ್ ಜಸ್ಟ್ ಸಿ. Contraction and release. ಕಾಂಟ್ರಾಕ್ಷನ್ ಅಂಡ್ ರಿಲೀಸ್, ರೈಟ್? ಸೊ ದಿಸ್ ಶುಡ್ ಹ್ಯಾಪನ್. ಇದಾಗಿದ್ರೆ ಆ ಸಮಸ್ಯೆ ಕೂಡ ಬರೋದಿಲ್ಲ, ಮತ್ತೆ ಲೇಬರ್ ಪೇನ್ ಅಲ್ಲಿ ಇನ್ನೂ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಕಾರಣ ಲೇಬರ್ ಪೇನ್ ಹೆಣ್ಮಕ್ಳಿಗೆ ಆ ಸಮಸ್ಯೆ ಆ ಸಂದರ್ಭದಲ್ಲಿ ಎಕ್ಸ್ಪ್ಯಾಂಡ್ ಆಗುತ್ತೆ. ಸೊ ವೆಜೈನಲ್ ರೀಜನ್ ಎಕ್ಸ್ಪ್ಯಾಂಡ್ ಆಗುತ್ತೆ, ಮಗು ಹೊರಗಡೆ ಬರಬೇಕು. ಸೊ ಅವಾಗ ಕೂಡ ಅದು ಈಸಿ ಆಗುತ್ತೆ, ಅಂದ್ರೆ ನೋವು ಗೊತ್ತಾಗೋದಿಲ್ಲ, ಪೇನ್ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಅಥವಾ ಸ್ಟ್ರಾಂಗ್ ಇರುತ್ತೆ, ಸೊ ಸ್ಟ್ರಾಂಗ್ ಇದ್ದಾಗ ಪೇನ್ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಈಗ ಮೆನ್ಸ್ಟ್ರುಯೇಷನ್ ಬರುವಾಗ ಕೆಲವೊಬ್ಬರಿಗೆ ಪೇನ್ ಆಗುತ್ತೆ, ಕಾರಣ ಏನಕ್ಕೆ? ಅವ್ರ ಆ ಪಾರ್ಟ್ ಸ್ಟ್ರಾಂಗ್ ಇರೋದಿಲ್ಲ. ಯಾಕಂದ್ರೆ ಬ್ಲೀಡಿಂಗ್ ಆಗ್ಬೇಕು ಅಂದ್ರೆ ಕಾಂಟ್ರಾಕ್ಷನ್ ಮತ್ತು ಎಕ್ಸ್ಪಾನ್ಷನ್ ಆಗೇ ಇರುತ್ತೆ ಅಲ್ಲಿ. ಅದಾದಾಗ ಮಾತ್ರ ಹೊರಗಡೆ ಬರುತ್ತೆ. ಕಾಂಟ್ರಾಕ್ಷನ್ ಆದಾಗ ಬ್ಲಡ್ ಹೊರಗೆ ಥ್ರೂ ಆಗುತ್ತೆ. ಸೊ ಅದು ಸ್ಟ್ರಾಂಗ್ ಇಲ್ದಾಗ ಮಾತ್ರ ಪೇನ್ ಆಗುತ್ತೆ, ತುಂಬಾ ಭಯಂಕರ ಪೇನ್ ಆಗುತ್ತೆ, ಅಂತಂದ್ರೆ ಇವು ತಡ್ಕೊಳಕ್ ಆಗೋದಿಲ್ಲ, ಅಷ್ಟು ನೋವಾಗುತ್ತೆ ಕೆಲವೊಬ್ಬರಿಗೆ. ಅರ್ಥ ಆಯ್ತಾ? ಸೊ ವಿಚ್ ಆರ್ ಪಾರ್ಟ್ ಈಸ್ ವೆರಿ ಸ್ಟ್ರಾಂಗ್ ಆಫ್ ಯುವರ್ ಬಾಡಿ, ಯಾವ ಥರದ ಕಾಂಟ್ರಾಕ್ಷನ್ ಕೊಡ್ರಿ ಅಲ್ಲಿ ಪೇನ್ ಆಗೋದಿಲ್ಲ. ಬಿಕಾಸ್ ಇಟ್ ಈಸ್ ಏಬಲ್ ಟು ಹೋಲ್ಡ್ ಇಟ್ ಈಸ್ ಏಬಲ್ ಟು ಬೇರ್ ದಟ್ ಪೇನ್. ಅರ್ಥ ಆಯ್ತಾ? ಎಸ್. Any doubts?